there's one point you have to be cautious about. If you start too close to the left costal margin, you might miss a hugely enlarged spleen. So in certain situations, you may have to start feeling in the right iliac fossa and then move across the midline diagonally towards the left costal margin. If you find a mass here, which you think is a splenic mass, see whether you can feel the characteristic notch. There are certain other characteristics of a splenic mass. For example, it moves diagonally across the midline, moves with respiration, it is dull over the lump and there is no band of resonance, and the dullness continues with the normal splenic dullness. You cannot get above the lump. You use the bimanual technique to palpate for any renal masses. Left hand is placed posteriorly and the right hand anteriorly, the left loin. You bring two hands together firmly but gently. You ask the patient to breathe slowly in and out and see whether you can feel the moving kidney mass between the two hands. If you find a renal mass, you can confirm it by using the technique called ballotment. In this, you ballot the kidney or a possible renal mass with your left hand and see whether the mass comes and hits the anteriorly placed hand. Once you finish palpating the left kidney, you repeat the procedure on the right side. First you bimanually palpate the kidney and then ballot if there are any lumps. After inspection and palpation, the third step is the percussion. There are two important points that you should keep in mind about percussion. First, you always percuss from resonance to dullness, never from dullness to resonance. The second point is the percussing finger should be always parallel to the border where you expect the dullness. For example, if the border of dullness is like this, your percussing finger should go parallel to that. When you percuss, only one finger should be touching the abdomen, and you percuss on the middle phalanx, and the percussing finger should hit that finger at right angles. The movement occurs at the wrist joint. First you elicit the flank dullness. When there is ascites, fluid tends to gravitate towards the flank and the bowel containing air tends to float at the center. Percuss parallel to that border and move laterally to see whether there is any dullness. If there is any dullness, then you look for shifting dullness. If you find an area in the flank when the dullness first appears, you keep the finger without moving and get the person to roll over to the opposite side. See whether that area that was earlier dull, whether it has now become resonant. If there is a lot of free fluid in the peritoneal cavity, not only the flanks but even the hypogastrium will be dull. That dullness is called horseshoe-shaped dullness. To demonstrate the horseshoe-shaped dullness, you start percussing in the epigastrium and again go parallel to the expected border of the dullness. a patient with gross ascites, the whole abdomen will be distended and you will be able to elicit the fluid thrill. To elicit the fluid thrill, you can ask the patient first to keep his hand in the midline. Then you tap on one side and see whether you can feel the thrill, the fluid thrill here on your opposite hand. Presence of fluid thrill indicates gross ascites, and the absence of fluid thrill does not mean that there is no free fluid in the abdomen. The reason for asking the patient to keep the hand here is to prevent the thrill being conducted across the abdominal wall to the opposite side. When the hand is placed, the thrill that is conducted through fluid. The last step in the examination of abdomen is auscultation. There are few things in the abdomen that you auscultate for. You have to listen to the bowel sounds, and the position for that is just below and to the left of the umbilicus. See whether the bowel sounds are increased or whether they are absent. You listen for a renal bruit at a point halfway between the umbilicus and the siphisternum, about 2 centimeters lateral on either side of the midline. You hold the stethoscope and listen carefully for a possible renal bruit. If the spleen or the liver are enlarged, you ought to listen over these organs for 2 things. One is a bruit, the other one is for a rub. When you listen for a rub, you ask the patient to breathe in and out quietly. To listen for a bruit, you have to ask the patient to hold the breath. Bruit could be very soft and it could easily be missed. Examination of the abdomen is not complete unless you examine the hernial orifices and external genitalia. Where relevant, you should perform a rectal and vaginal examination as well. You should be very gentle with your technique and make sure that patient is comfortable throughout the examination. As Gamini is a volunteer, I did not